Has the investment translated into better services on the ground?
Well, to translate, we go, when we talk about investment, we're talking about budget. Budget in this case. We're talking about, I hope you mean maybe the community health promoters, you're talking about the primary health care.
Precisely.
Because remember, in our previous budget, we had around close to 138.1 billion shillings allocated to healthcare. To us, it's a bit of improvement from previous budget. However, it still fall below what is actually expected of us. Out of that chunk of money, 13.1 billion went to primary health care. And it's primary at that community level that actually the chunk of work is done at the primary, at the community health level, at the household level. So we can be able to say authoritatively that there are some slow, this progress, but the progress actually is slow because we are not seeing most of the county government embrace all what is supposed to be embraced, because we're talking about monies being allocated, but then the workforce itself, the HRH component is actually not there, because you can allocate money, Peter, but when you don't have people who are supposed to be implementers of these policies, then you still have a problem at the end of the day, because at the end of the day, you'll build hospitals, you can build dispensaries, you can build medical supplies, but medical supplies and hospitals cannot be able to treat patients. We need healthcare providers to be there to be able to treat patients, to be able to.
So we have an issue with staffing.
We have there's a whole issue about the staffing component, which is actually we're actually very low, and the county government are not actually employing, and this is the reason why we're actually calling as healthcare workers the debate about the Health Service Commission. And I think we are facing a problem, and this is the right time. And I feel, because we are in electioneering year, we are actually approaching electioneering year, we're actually proposing to the government that as we vote for our leaders, we also need to have a Health Service Commission. As healthcare workers, we vote for it, because we feel, as a nation, counties have failed to manage healthcare services in this country. And therefore, it's important, just like education, just like security, just like anything, health is also very important to this country. We want it managed at the national level. Yes.
So what lessons have we learned from our universal health coverage program exposed about managing healthcare and the workforce?
What I want to say is that UHC, it's based on paper, that it's being practically done. Remember, we have got Vision 2030.